Hello guys, welcome to my channel Learn with Geetashree. If you are viewing my channel for the first time, please subscribe my channel. And today we are going to see the important interview questions for medical coding freshers. Generally, the interview will be having 3 rounds. Those are written test, technical round and HR round. Today, let's see the frequently asked questions in written test and technical round. In written test, you have to manually write the answers for the questions they given, and in technical round, it will be a face-to-face interview round. And it's a basic question. What is medical coding? Medical coding is the transformation of diseases, processes and medical equipment supplies into alphanumerical codes. And sometimes they may ask why we need to convert the diseases and diagnosis into codes. And second one, revenue cycle management. Also they can ask what is RCM? Revenue cycle management, it is the payment cycle between the patient, provider and payer. Tell me something about ICD. ICD is the International Classification of Diseases. It is published by WHO. It is having nearly 70,000 codes. We use this book for coding diseases and diagnosis. You can answer like this simply. And definitely you will be having this question in technical round, like explain any one body system. You must choose a body system in which you are perfect. And they may ask question from that body system. I will suggest you to choose either cardiac system or respiratory system, and because they are very easy to explain and not that complicated. What are the parts of a nephron? Nephron is composed of glomerulus, Bowman's capsule, proximal convolute tubule, distal convoluted tubule, loop of Henle. What is emphysema? Emphysema is a condition in lungs that causes shortness and death due to damage of alveoli. What are the layers of brain? Generally, we will call these layers as meninges. Remember that also. There are 3 layers for brain. Those are dura mater, arachnoid matter and pia mater. What is ostomy? This is a basic question that you must know. Ostomy is the artificial opening in the body made during procedure or a surgery. What is antepartum? It is the period before childbirth. What is neoplasm? It is the abnormal mass of tissue, the growth of which exceeds and is unlike as a normal tissue. This is also an important question you must remember. And the 9th one is what is diabetes and types of diabetes. Diabetes is a chronic disease characterized by increased blood glucose levels, and it is having 2 types, type 1 and type 2. You must also explain about the type 1 and type 2. Once check with these 2. What is myocardial infarction? Myocardial infarction is caused due to reduced blood flow in the coronary artery, and it is also called as heart attack. What is atrial flutter? Atrial flutter is the rapid and abnormal heart rhythm. Difference between new patient and established patient. You may see these 2 terms during CPC preparation or during the course time. A new patient is someone who has never seen by the physician in the last 3 years, and an established patient is someone who has seen by the provider in last 3 years. It is also an important question. And the 13th one, abbreviations of COPD, GERD, CAD. Not only these 3, you must be aware of all the abbreviations in the anatomy section, like COPD, GERD and CAD. COPD is the chronic obstructive pulmonary disease. GERD is the gastroesophageal reflux disease. CAD is the coronary artery disease. 14th one, what are metatarsals and what are metacarpals? Metacarpals are the bones of the foot and metacarpals are the bones of the hands. Difference between tendon and ligament. This is the most important question. This is asked in CPC exam also. Tendon connects to muscles to bones. Ligaments, it connects bones to bones. What is the function of liver? What is the function of pancreas? These are the basic questions you must know. You will lose your impression if you didn't answer the basic questions also. So the function of liver is it filters the blood in the body and breaks down the poisonous substances, and it produces the bile enzyme. Function of pancreas, it controls blood sugar and metabolism within the body. You can also another point here, it produces the insulin. What is postpartum? It is the period after childbirth. Remember the difference between antepartum and postpartum. There are more chances that you will confuse here. Which cells in the blood do not have a nucleus? Erythrocytes will not have a nucleus in the blood. Which veins carry oxygenated blood from lungs to heart? Pulmonary veins carry oxygenated blood from lungs to the heart. The- There are few more important questions that you will be seeing in technical round and written test, and I'll be doing a part 2 video of that. Stay tuned and subscribe to my channel. You will be having many updates and so many important things in this channel. Subscribe to Learn with Geetasri and stay tuned. Bye bye.